Papua New Guinea is an island country that lies in the southwestern Pacific, consisting of both the mainland and 600 offshore islands. Because of its geography, 85% of the population live in isolated communities in rural areas. Gender-based violence, or GBV, is one of the most pervasive human rights violations in countries around the world, and this includes Papua New Guinea. The 2016 to 2018 Demographic and Health Survey data from the National Statistical Office demonstrates the high levels of violence women experience in the country. 56% of women aged 15 to 49 have reported experiencing physical violence in their lifetime, while 28% have reported experiencing sexual violence. And 63% of women who are or have been married have reported experiencing physical, sexual or emotional violence from their spouse. UNFPA is supporting the government of Papua New Guinea in strengthening the quality of services to respond to the needs of survivors of gender-based violence. This includes high-quality and coordinated health, social, justice and police services that are vital for the long-term recovery of survivors of violence. With the support of Zonta International, UNFPA has partnered with the Ministry of Health to bolster the health sector response to gender-based violence. This includes delivering training and workshops to service providers.
Personally, for me, the training was an eye-opener. Initially, I really didn't know the referral pathways for gender-based violence victims. I took it for granted that there were people in specific places that knew what to do and knew where to send clients to when they encountered cases like this. But during the training, it came to my attention that even people that were in these specific places were not too sure about how to refer gender-based violence victims to where they were supposed to go to.
And with the assistance of the training, we're able to sensitize more health workers to understand what GBV is all about. And it's not just seeing somebody with a bruised face or a cut on arm from a domestic violence or intimate partner violence, but to take it further, looking at the psychological part of things, where a person who is emotionally affected and needs assistance, who needs to go for counseling.
Now that we have the FSC established, it has made it a lot easier, especially when we have women clients or even patients who come in seeking help with regards to GBV. We know where to refer patients, especially within the urban setting, because there is a place there we can be able to make contacts with the people who are working there and then make referrals. So slowly we now advocating that there is a place where women can sought help.
For example, if I have a patient coming in and we give treatment and it's like ongoing, they continue to complain of the same problem over and over, then it's like you have to think, okay, what is the problem? So after the training, I was like more trying to focus on trying to find out if their livelihood at home is okay, or if they have other issues apart from the illness they're presenting with. So I was able to really get the patient aside and talk to them about how they're staying at home, if they are married, if the lady is married, how is her relationship with her husband.
The outcomes were very good after the trainings we attended. Before that, the outcomes were bad, like we lost the survivors, they lost to follow up. I would say generally they were not treated well.
The GBV cases, they're already traumatized. And if they come through outpatient, there's lots of people there. So we need to provide a quiet place so that they can feel more comfortable in sharing their experiences, and also in terms of us providing the PFA, the psychological first aid. It's very, very important.
In terms of the coordination, yes, it's a massive task for the office itself, because when we see the environment setting of Melbourne province, it's a maritime province, to reach information or to disseminate information to other parts of the province, then you need to cross vast bodies of water. So coordinating stakeholders, working together with partners is very important for the office itself.
I've attended 2 of the programs. For me, what resonates well is that on how to manage our cases. There are certain steps that we have to follow, and so for me it's a really good guideline and a good framework to work within, and it's a survivor-centered approach. And so it's not about what I think as a counselor, but I take my cue from the survivor, and it's responding to the survivor's needs.
Before I didn't go through this training, and I was thinking that, oh, okay, there's a client coming and I don't really understand the healing process and how I will work with that client and the validation part of it and all these things. Like, I really learned a lot and it empowers me, and I'm really thankful for this training. As people, like me, I'm really very thankful that now when a client comes in, I know where she's coming from.
With the trainings, Zonta has pretty much supported a lot of things for us for the Family Support Center with Milimbe Provincial Health Authority. One is upgrading or refurbishing our clinic. Funds came from Zonta, which has now given us rooms in there to see patients in privacy. We have an examination where we don't need to send patients back and forth and all that. So now we're able to do case management, manage the cases, do safety plans with the survivor, and it's always survivor knows best. So previously we always think that we know best, but no. Now with this approach, case management, survivor knows best. So we've always follow the survivor.
Since 2020, with the support of Zonta International, UNFPA has strengthened family support centres in Milne Bay Province and the Autonomous Region of Bougainville by refurbishing facilities and improving their capacity to deliver quality services and referrals to survivors of gender-based violence. Investing in strengthening the capacity of more than 100 gender-based violence service providers, UNFPA is enhancing knowledge and skills on survivor-centred approaches, first-line support, case management, and coordination of multi-sectoral response services. In order to ensure that these approaches are institutionalised, UNFPA supports the development of national curriculums and the strengthening of existing referral pathways for survivors. UNFPA remains committed to the continual support of government departments in Papua New Guinea to enhance access to quality life-saving services for survivors of gender-based violence.